Like if a patient needs any items, we can like push this cart to the room.
So we have a number of different ways that volunteers can get involved here at Virginia Mason, and they have all different types of backgrounds and skill sets. We have retired CEOs who are coming back and volunteering. We have students who are interested in going to medical school. We have neighbors. Everyone in the community helps and volunteers, which is remarkable, and I think something really special for us here at Virginia Mason.
Would you like a snack?
We're at North Star Lodge in Yakima, Washington.
You're welcome.
It's a cancer treatment center, and there's two halves of it. There's the infusion half and the radiation half, and I volunteer on the infusion side of it. I'm going back to school in a couple weeks, so. I started volunteering here a few years ago after my mom passed away of cancer.
Is this chair okay for you?
Yes.
Good. Have you been on your trip yet?
Because I knew how much she loved to come here and how the volunteers impact her life. And so I thought that like I wanted to do that for someone, and I wanted to come here and just talk with patients, make sure they feel that there's someone here for them, rooting for them.
Yeah, definitely. Maybe next year.
So I know that sometimes they're lonely, and so while I'm here I just try to like make them forget that they have this disease.
And she's always smiling. I mean, just that pretty smile. See that?
I tried.
I know that patients a lot of times they feel like they've changed a lot from previous to their diagnosis, and not just like physically, but also like their appearance. They look in the mirror and they don't recognize who they are. And I know that patients often will bring a phone and they'll show me pictures of themselves and be like, "This is what I used to look like." And I like to reassure them and say, like, "You still look like that. You're still that person. You're still really strong, and you're fighting, and you're doing well."
We think it's really important to try to empower them to really run with this. I got involved with the Virginia Mason Foundation specifically through the Audience Development Committee is the name of what the team that we're on. And so the role that we've been playing is trying to engage the next generation, the millennials, the younger folks who are just starting out in their careers and trying to get involved in the foundation.
I think volunteering for me is an important thing to do because it's being a part of something.
I don't think you go into volunteering for the purpose of getting something back necessarily. I think really it's about bringing our gifts to the table and figuring out how we can add value to what they're doing, and you get an intrinsic reward just from doing that.
We're helping people develop the heart and the passion into something, and 10, 20 years from now, they could be potentially, monetary donors, but also have, some, heartfelt compassion or ties to the charity, which is actually going to be an amazing thing to see, and hopefully we'll be around to see it. Yeah.
We're at the Pacific Science Center. Every Saturday afternoon, the Science Center hosts a Meet a Scientist gathering. Open two of those guts side by side, find the things that are the same and the things that are different. I am a scientist, and I've come to play and have chats with everyday people about whatever type of science that they're interested in. You found all the nodes inside that gut. I work in a research lab at the Benaroya Research Institute at Virginia Mason. What I'm doing here is I'm sharing the basic knowledge in a way that invites a chat with the public to learn more about the world around them.
There's the big ones in there.
How about what's inside of them? It's a really good venue to share the amazing abilities of the research that's up on the hill right here in the neighborhood. You're very discerning. You are both scientists at heart. But I just know that it's important for me to connect to a variety of different groups, not just here at the Science Center, but at other organizations where the need to continue gathering knowledge is valued and is important for helping our community be better.
Oh, thank you.
You're very welcome.
My husband lived here the last 2.5 years of his life. He had Huntington's disease. It was extremely good care and just very happy.
Hey, how are you doing, Ron?
Yeah.
Good to see you. Well, good. Looks good. You look good today.
I always knew that I wanted to come back, and
here I am. I came back about 3 years ago and I've been volunteering since then.
How are you feeling these days?
Good.
Other days I may just go visit somebody. There may be something where somebody needs help with something. Maybe it's just reading something. Maybe it's just providing companionship in some way.
See ya.
All right, thank you.
Yeah. How about you?
What we can do is we're supporting the patients, but we're also supporting the staff so that they can have more time to do the work that they are most skilled to do.
You're being grateful.
Yeah.
I feel like I'm helping, and it's just so nice to be able to contribute to someone. But at the same time, it's so humbling.
Happy to do it.
If I can just do a little bit to make somebody else's life easier, it's enhancing my life, too.
There's nothing like boots on the ground, right? I was invited to join the board in 2001 by Dr. Kaplan, and when he first introduced himself to me, I knew nothing about healthcare, nothing about Virginia Mason. I wasn't a patient here, and that needs to be reflected. I said yes because Gary and the leadership were very committed to adopting the Toyota production system and applying it to healthcare. In a way, it seemed like a challenge to me. I'd done that work in a manufacturing and engineering design environment, but I didn't see any reason why it wouldn't work in healthcare. There's really nothing right now, very few things in our country that are more important than figuring out how to make healthcare affordable, accessible, and really improving the quality of healthcare across the country. So to be part of that seems to me to be pretty rewarding.
That's fine. So tell me about what happened.
I slipped off a...
The first time you go through a joint replacement, it's scary, and you don't know what to expect. I go around and talk to patients who have had a joint replacement, either a hip or a knee, since I've had both. I could put 50% weight on the hip, so I was on a walker for about a month. I walked into a room and I introduced myself, and one of the patients said, "Oh, a survivor." I hadn't thought about it like that, but and she was delighted to talk to someone who'd actually gone through it. I feel part of the team. I'm not the surgeon, I'm not the nurses, I'm not the physical therapist, but I feel I'm part of the team that provides valuable information. Virginia Mason takes very good care of their volunteers. They make you feel special.
Without volunteers, we wouldn't be able to keep our patient at the top of everything that we do.
Okay, let me know if you needed anything.
What have you got in the other nodes there?
As a nonprofit organization, we rely on volunteers to come and help us with our daily work, to come and help us with future plans, and really to just come alongside our patients in their time of need.